stage Dr. Chethan, Sathya, and Andy Slavitt.
Is this one on? Oh, perfect.
Hello?
Yep. Just double check, Andy, if it's working.
It's working?
Yep. Beautiful. So, thank you all for being here today. A huge thank you to Neema and the Blooming Health team for putting on this incredible event. I've had the honor to attend over the last few years, and every year it keeps getting better and better, and I've seen the type of action that comes out of these events, so thank you for being here. It's really an honor today to be joined by the one and only Andy Slavitt. Almost all of you, I'm sure, know the incredible work he's done across government, healthcare delivery, working with Obamacare to make it better. So it's truly an honor to have you here with us today, Andy.
Thank you. Great to be with you.
Absolutely. So let's start with some pressing topics. So I know the focus here is AI in our panel and scalable empathy and things like that, but I have to ask, you've had such an incredible career in so many different things. One of the pivotal moments in your career was being asked by President Obama to help kind of fix Obamacare, right? Can you tell us a little bit about that experience? I mean, how did you get the call? How did that even happen?
Yeah, thank you for bringing up that painful memory. This was 2013, and you might recall that the ACA launched. This was on October 1st, and the website didn't work. And I don't know about you, but most people did the sensible thing and looked at it and said, well, this is too bad. I did the unsensible thing that I called Washington and asked if they needed help fixing it, which is the kind of call you expect to go unanswered, right? So it feels like, why not call? It turned out I was the only person foolish enough to call. And on October 24th, they announced that I would be leading the turnaround of healthcare.gov. And at the end of the press conference, they announced that it would be fixed within 5 weeks, which they had failed to tell me. And so, I moved to DC. My wife just kicked me out the door and said, don't come back until it's fixed. And I lived in a hotel and for the next 5 weeks, tried to figure out why did it break, what was going on, why was it broken. And I thought a lot was riding on this because here we were with a piece of technology standing in the way between not only millions of people getting insurance, Medicaid or ACA, but people's faith in the ability of the government to actually execute a program like this was at risk based on some technology, such as the state of things. So thanks to the help and work of thousands of people, we got it turned around and got millions of people insured, and that led me to end up staying in the administration.
Incredible, and thank you for the effort you put into that. The ACA has come such a long way, and so many millions of Americans are dependent on that. I mean, how many times during that experience did you ask yourself, or start to doubt yourself, and just say, maybe I can't fix this? I mean, were there moments like that?
Oh, every day. Among other things, there was no site map, there was no architecture, there was nothing we could learn about the site. All we knew was that there were about 6,000 bugs, and we had 5 weeks to fix 6,000 bugs. And me being the smart person that I am, all I did was I took 6,000, divided it by the number of days in 5 weeks, and said, oh, we've got to get out 1 bug a day, every day, for between now and 5 weeks. And we need that many developers who can go out and get those kinds of bugs out. So that was literally the extent of the software plan. Well, 2 things happened. If you know anything about code, which I should have but didn't, is if you get out bugs in software, you often uncover new bugs because people start getting through the site and you find other places that are broken. And the other thing that happens is as more people are able to use the site, you finally test the hardware and see if the hardware is working. So 2.5 weeks in, about halfway through, we didn't have 6,000 bugs, we had 8,000 bugs. And we already proved hardware needed to be completely replaced. And the first time I spoke to my wife, I put down the phone and called her, and we were halfway through. I said, "Honey, you ever step into a leaky boat and put your foot through it? That's what I just did. I've made this worse. We're in worse shape today than when I started, and we need all new technology, and we have, and it's just more of a disaster. And I've just made it completely worse." She said, "Poor her." She said, "What any good partner, spouse would say, oh, don't worry, honey, you'll figure it out." Indeed, what happened was, in the middle of a crisis, I picked up the phone and called the CEO of Northwell and the CEO of all these other companies and said, "You need to take the next technology that's out in front of your lines and deliver it here to Washington. We're going to fail, and I need it here." And they said, "Okay, great. That'll be about 18 months before the technology can arrive." And so I had to call the people who ordered who would order the most recent technology that was on the line, and said, "Can we please take this? It's a national crisis." Took the technology, and all of a sudden things started to work better. And we squealed in just around Thanksgiving, which was about 5 weeks, with the site basically finally functioning. But it was needless to say, it was not a well thought out decision for me to call the White House in the first place. And I had no business being there because it was really just trying to figure it out. But a bunch of really talented people around me who were really super committed to doing it.
Incredible. Now, there's a ton of CBOs here today, healthcare leaders, payers, folks on the government side. I mean, what did that experience teach you about the importance of private-public partnerships, working with startups early in the process, or larger technology companies?
Yeah, I mean, it's a cliche, but you can't get anywhere alone in this world. And I think the idea behind being able to pick up I've operated in 2 crises. I led that crisis, and then I led us way out of in the pandemic when we couldn't get enough vaccines produced. We couldn't vaccinate the country. So I was back in the Biden administration in the White House for that. And operating in a crisis gives you the ability to pick up the phone and call anybody. I need to call the CEO of CVS or Walgreens and tell them we need them to start to transform their stores, to start to add vaccinators immediately. I need them to make sure that they overweight the vaccines into communities that are underserved. You can do that in a crisis. So what it sort of lessons it sort of taught me is if it's important enough, you got to get people into that mode that it is a crisis and that it feels like a crisis, or people will go back to the habits that got us here in the first place, which is being silent in their thinking and being just very self-interested about their own. And look, healthcare is complex enough in our own organizations, right? Just making your own organizations work, let alone trying to optimize for what works. But I've had the freedom in those situations to literally pick up the phone, Chethan, and call people and say, we need your help, and have people respond. Now, when you're doing it not from the White House, but from the perches we sit in every day, it takes a different level of persuasion to do that. But it's absolutely clear we need each other, or there's no way we make progress.
So fast forward a little bit to right now. We live in a very, feels like polarized world. Folks have a lot of course, feelings about different administrations and politics that are happening in this country right now. I've heard from a number of leaders that the current team at CMS, for example, and I've seen it, is doing incredible work when it comes to bringing health technology companies into the mix. They're thinking about things very innovatively and leading in different ways. How would you respond to that?
I think the current team at CMS is great. The day after he was appointed, Dr. Oz, who I didn't know at the time, called me and said, "Hey, Andy, I've been asking around who did this job well, and your name keeps coming up," which is completely talked for 2 hours. And, you know, what I was listening for was, is this a person who feels entitled to this job and has some sense of, you know, that the mission is sort of beneath him, or is this someone with a lot of humility who's going to embrace this mission, who's going to build a team, who's going to respect people who work in this agency? And, you know, he asked me very humble questions. What does it take to do a good job? How do I do this in a way that stays out of trouble? How do I, you know, what's the true north? Who do I help? You know, and that began a series of conversations that we've had and continue to have, where he's, look, he didn't have to reach out to me. I served in a Democratic administration. He's serving in a Republican administration. But as I said to him, and I say it to you, 95% of the things you do in that job or in healthcare have nothing to do with politics. And that's really important because people really don't want, when someone in your family gets sick, the last thing you want is some ideology or some principle to get in the way of the best possible care, the best possible access to services of any kind. And he, I think, recognized that. He brought in a very good team. More broadly, you know, when we left the first Obama administration, the last Obama administration, and the first Trump administration was coming in, the president said to us, you may not agree with the new administration that's coming in, but we have an obligation to run a great transition. And he said the best transition in the history of transitions is recognized to be the transition from George W. Bush to Obama. And widely recognized that they ran the most professional, thoughtful transition. So he said, I expect the same from you. And so, you know, I think it's fundamental, a few things I believe. One is, there's a lot to disagree about, but we've got to learn or relearn how to disagree courteously, professionally, and in a way where you can look at the person who we disagree with on an issue and recognize they still care about the country. They just may have a different approach to get there. Now, that's not going to be true with everybody, but it's going to be true with the vast majority of people. And even ideas that, you know, I've been opposed to my whole career, like work requirements for Medicaid, would be one that's been anathema to what I believed in and still believe in. I can't say that the people who believe in work requirements for Medicaid hate Medicaid or hate the program. I mean, you can say that, you can feel that way. But how far does that get you? And, you know, better off to try to fight for the things you believe in, but try to work with the people who you have policy disagreements with, and try to make those policies better, try to understand where they're coming from. And you're not going to agree on everything, and there's certain things that my Republican friends and I don't talk much about because we know we're opposed. But 95% of things we do agree about because they really are about helping that person or that population who in a moment of crisis needs the healthcare system and making sure that the system's available for them. And that has very little to do with politics.
Well said, well said. And you and I definitely agree on that. You know, I think the more you have these conversations with folks that you think you're going to disagree with, the more you realize, I mean, there's so much nuance in every conversation, right? And a lot of these folks currently working are deeply invested in American healthcare, but they just might have different views about it. Whenever I've been involved in some of these convenings where you're trying to find that common ground in our current political environment, the flip side of the conversation is that there are drastic Medicaid cuts on the horizon, right? Millions of Americans are going to lose healthcare potentially. How do you encourage folks to think about those two kind of opposite things, right? And I would say for folks in the room, what do you think are going to be the major implications from those Medicaid cuts on startups that work in the space of, you know, partnering with CBOs and social care transformation?
Well, look, a whole bunch of new challenges, and I think we need to recognize them as challenges and not sugarcoat things. You know, for one, I think our obligation is to try to do as best we can for the individual involved. I was with the CEO of Chethan, Sarah London, and she was telling me, and you only know this, and she's not alone in this, but they're starting job programs within Chethan to be community health workers and social workers and other types of jobs, so that they can start to reach out and employ some of the people that they provide benefits to, so that they can keep their coverage for those who don't have employment. They're creating volunteer work. They're doing a bunch of different things. So, look, it's an opportunity for some creativity. Again, without sugarcoating things, it's an opportunity to think differently. It's an opportunity to start with the person at the center of the equation. The new head of Medicaid, Dan Brillman, is a technology person. Comes from a tech company that we're invested in, and he's doing as best as he can to roll out really prototypical, like federal tech standards that everyone can use to get people compliant, to get people connected, so they can maintain coverage. I think it would be a mistake to think that that they're safe, that just cynically want to get people off the rolls, even if they have employment. But it would also be foolhardy to think that there isn't.
One, two. You can use your microphones now, please. Thank you.
Yeah, tech is so unreliable. So I don't know if you heard what I was saying back there, but I think it's easy to go through healthcare or whatever we do and get to these moments of despair when you feel like I can't make the system better, I can't affect the greater good, I can't, and that's not why any of us are in this room. We're in this room to get inspired by one another and see what is possible. And I will tell you, just from the perch I had running CMS, everything is possible. It's not scaled, but it's possible, because you could take any healthcare problem you want in America, and there's someone somewhere who's doing a good job solving it. There's someone who's dedicated to the kids and the families and the people who are most in need, and have got innovative programs. What we haven't figured out is how to make these things work system-wide. And that's where the smart thinking and the technology and some of the capital and some other things have a role to play.
Well said. So we have a couple minutes left. I have 10 questions or so remaining. We could talk with Andy for hours. Let's switch gears a little bit and playing on what you just said. In your role as GP at Town Hall Ventures, you guys have been invested in some incredible companies that are making frontline changes. Some of them are CBOs. How do you think about investing in companies, let's say, that it's a little bit more difficult to maybe articulate that ROI? And what goes into your thesis at Town Hall Ventures?
So for those who don't know, Town Hall Ventures, which is a firm that I'm associated with, partner at, we started in 2018. Our goal was to build an investment platform that would primarily innovate for communities that didn't have the focus, where people weren't focused when they were innovating. You can't walk a block in healthcare circles without running into a longevity company or some app we're doing really well. But the real problems in our healthcare system, as I think everyone in this room knows, that's not where those problems occur. And I wanted to move capital and policy and resources and technology into those communities because those are great markets, great opportunities to solve. And importantly, this is not to do the job of the nonprofit or the CBO. This is to complement it by saying there are real financial opportunities and reasons for us to spend real capital in these communities. Why? These are large markets. I mean, if you look at it from a pure investing standpoint, these are large markets and big problems. Yes, the margins aren't necessarily going to be huge, but if you solve problems for lots of people, particularly people who others are ignoring, there's a lot of opportunity. And in the last 8 years, we've invested in rural America, we've invested in dual eligibles, we've invested in frail elderly, we're making an investment in home-based community services, we've invested in the Hispanic community, we've invested in the Black community in Chicago, we've invested in all of these areas that we think have been lacking in real capital resources. And we've got amazing, and I say we've been investing, but we're not the most important part. There are founders and entrepreneurs who've had these ideas that are doing amazing things. And it's a privilege to back them because they have a vision. But I would say that we tend to not invest if we think it's not going to be sustainable from an ROI standpoint. If it's not going to be sustainable from an economic standpoint. We don't think the role of venture capital is to go to places that can't get returns. Because I want people to keep coming back more and more, and even more than that, I want other firms to say, oh, that feels like a smart place to invest capital. Because there are companies like City Block Health and Hopscotch Health and Sathya Health and others in our portfolio that are doing really well at it. And sometimes, we'll fixate on a problem. That we have a company here in New York called Northwell Health. They focus on Medicaid kids in the public schools, providing mental health resources to the overwhelmed counselors. But it took us 2 years to find that company. 2 years to find an idea that really resonated with us, but we were fixated on that problem. So we tend to obsess about the problem and the challenge, and then hunt like crazy for the founder or entrepreneur that has a vision, and then get behind them.
It's amazing. And when it comes to leveraging technology to really transform care for a lot of these very vulnerable populations, folks who have historically not had great access to the health systems or the healthcare systems in general, what excites you the most? A couple areas where you think technology can really, really make a difference, or you're seeing it make a difference.
Well, look, I think you're going to spend the day on a lot of great examples, I'm sure. But my sense of things is that with even technology that we can already see, like open evidence, use open evidence.
Yeah.
What's your view on open evidence?
I think it's great. I mean, it's good for questions I have for patients in the clinic and so on. But as a surgeon, I don't use it as much as an internal medicine doctor.
I think what we've done is we've basically given the ability of really remote physicians and non-physician clinical teams, and even non-clinically trained teams like community health workers to upskill their knowledge really dramatically. And that means that this vision that we shouldn't just allow everybody to have access to care, but we should be able to give people access to really high quality care is much more real, it's much more realistic. And look, this is interesting because AI is wholesale different than past technology waves that hit healthcare. That's probably the one thing I'd leave you with. We went through electronic medical records. You didn't see doctors clamoring, oh my God, I'm so excited to use Epic. Words I've never heard. Or mobile, or cloud, or anything. Whereas AI, this is self-generated demand. I mean, there are tens of millions of people every day that are. Yes, there are problems, but there are tens of millions of people a day, many of whom are saving their own lives using AI. And there's clinicians that are upping their game. And we, for the first time, have technology that sure. But an opportunity for us to reach people that we've never been able to reach before with really high quality care.
I couldn't agree more. I mean, I think the upskilling comment is spot on. You know, I mean, there's so much I think as physicians that we do that we think we have to be there in person to offer that exceptional care, but the ability to now upscale with AI, you know, ACPs, even primary care in rural America, underserved urban communities is huge. So I totally agree. We are over time. The last question I wanted to ask you is, there's been discussion in the past about, you know, using AI, for example, on vulnerable populations. What's the risk there? You know, is there, I've seen people write about that being experimentation. You know, maybe it's not the right thing to do. How would you respond to that?
Well, yeah, there was a piece in the Guardian which said we should not be using AI on particularly communities that are underserved, particularly unhoused communities, because it was a form of experimentation. And Tony Najayi, who's the CEO of City Block, and I co-authored a piece politely disagreeing, saying our bigger risk is that we end up creating another digital chasm where people who have access to technology and are comfortable with technology use AI for their benefit, and we somehow say it's not good enough for others, and I think that's wrong. You know, I think healthcare is becoming and will quickly become some combination of home, community, technology, virtual, inpatient, outpatient. You know, it's all going to blend together, and to say we can take one piece of that and hold it away from certain communities because it's not yet proven to be perfect, I think is a mistake. And it's not just because something's better than nothing. It's because people who want the very, very best care, cancer care, all kinds of complex care, are running towards AI for what it can do for them. And I think we have to make sure that it gets widely used and adopted. And I mean, you shouldn't be afraid of it. And if I know each of us as individuals, it's a new thing to learn. But if one thing AI is telling us, we're all going to need to be lifelong learners now. We're all going to need to learn how to cloud code, every one of us, because it's just the new world we live in. And if we do that, and we say, no, this is for us. That's what I think I want to leave you with is, don't look at this and say it's for someone else. This is for us, because the power of it is really great.
Andy, thank you so much for being here with us today and for all the work you've done.
Thank you.